Canadians are waiting longer than ever to receive surgeries, diagnostic scans, and appointments with specialists. And some are waiting so long that they are living in chronic pain each and every day. Inevitably, they are waiting so long and living in so much pain that they have no choice but to seek help out of province and sometimes even abroad. Sharon Kilkenny from Saskatchewan is one of those patients, and she joins me today to tell us about her story. So Sharon, thank you so much for speaking with me today. I really appreciate it.
Thank you, James. Thank you.
So Sharon, you've got a really interesting story about what you've been through. You've been through an incredible ordeal, really. We chatted about it, but for the people, tuning in and watching this, can you give us a brief background about your story from the moment you realized that you had a health problem to where you are today on a waiting list, waiting to receive surgery?
Okay. Well, I would say it started a few years ago, and it didn't really start out with pain. It started out with loss of balance, and I was having problems with balance with standing, and then it turned into a limp. When I would walk, I would limp, and it really wasn't until about 2019 that it turned into pain in the hip, and the pain would kind of go between the hip and the knee and back, but kind of back and forth. So that's when I first went to the doctor to ask her about it, and she said it was osteoarthritis, and that's kind of where it started.
Interesting. Okay, and then how did it progress from that? So obviously you had a chronic pain issue going on there. Tell us about how you worked through the healthcare system in that way. Like, was it easy to get appointments? What did your doctor say? Did they, was there any sort of diagnosis about what the issue was?
Well, not at first. At first, it was kind of a trial and error, trying different things. So I tried physio and chiropractor and 2 neurologists and a dermatologist and sports doctor. And this was over a period of time, of course, but I would just keep phoning and saying, can you refer me to this? Can you refer me to that? Because people were saying, well, have you tried this? Have you tried that? And so I was just kind of grasping at straws, trying to figure out what was wrong. And I didn't know if it was a hip issue. I just knew that I was having balance issues and pain issues. That's all I knew at that point.
So you went through all that, all the physio, all the sort of, the therapy and everything. Yeah. What was the final diagnosis from your doctor? What was it that they eventually told you was the root cause of all these issues?
Yeah, well, then the only thing really left to do, because there was x-rays and MRIs and bone density tests and whatnot done. So the only thing left to do was to send me to a surgeon. And that was kind of a last resort because we were kind of trying to figure out, can it be dealt with without surgery? Whatever it was, whatever the case was. And so that's when she referred me to the surgeon. And that would have been in April of 21.
Interesting. And did they say what it was? Was it you said it was osteoarthritis, or
yeah, that's what was causing the pain, but they said it was kind of bone on bone, because it was a hip. He said I needed a hip replacement. And so at that time, they said it would be about a year away.
A year away. So, and you had already been, dealing with this issue sometime prior,
yeah,
correct me if I'm wrong, just to understand, you started this ordeal in around 2019.
Yeah.
And at this point, this is 2021. So yeah. Already you've been, dealing with this issue for 2 years. And then finally you got a diagnosis that you needed a hip replacement operation. And even after that, then they were saying it was going to be about a year waiting list before they got you onto the operating table.
Right.
So yeah. It's quite a long time. That's an incredibly long time for you to be dealing with that. Tell us about the sort of the pain and the difficulty you were living in at that time, because obviously, for those watching who don't understand, obviously requiring hip replacement surgery is a pretty big deal. They don't just do it just for, no reason at all. So what sort of pain were you living in on a day-to-day basis with that?
Yeah, well, the pain would kind of come and go, but it would depend on, it would be worse depending on what I did. Like getting in and out of the car would be worse. Certain ways that I would lay in bed, I had to really watch how I did things. And I found that as time went on, I was sitting more and more and doing less and less, because it was just effort and pain and balance. And so at one point I wasn't using a cane, but now I am, and a walker. But before that I wasn't. So yeah, that's kind of how it progressed over the last year or so. And yeah.
So it's fair to say your quality of life was obviously,
yeah,
excuse me, diminishing, considerably as time went on. The longer you were waiting for this surgery, your quality of life was diminishing, and your health was diminishing, because obviously, you were struggling, and understandably so. Did the healthcare sector, your doctor, did they provide you with any medication to deal with the pain management at that time?
No, they didn't offer me any. Well, at one point when I was going to one of the neurologists, he offered me clonazepam, because he says, I see tremors in your legs. And I was like, oh, I don't know. But I tried it. And I said to him, is this stuff addictive? And he says, oh, yeah. I thought, why are you giving me this? Anyway, so I've actually weaned myself off, because I thought, we're not going there. And so I've been actually going to a naturopath and taking things that way. And that's how I control the pain, and is through things like naturopath products.
So that's really interesting. So if you don't mind exploring that a little further. So you were on a waiting list at this point for 2 years. You were facing another 1 year waiting list to receive surgery. So you're potentially looking at being on a waiting list there for about 3 years to receive hip replacement surgery.
Well, I wasn't on a waiting list for 3 years. I didn't get put on the waiting list until April 21. So
you were obviously like going to be waiting, I should say. I apologize for that. I correct myself there. You were going to be waiting for a surgery there for about 3 years.
Yeah.
All the while they're giving you this medication, which they've openly said it is addictive in that sense. Did the doctor bring up anything with you about, I'm not a doctor myself, but I imagine being on that medication for a month or so, 2 months or so, okay, fair enough. But for 3 years, seems to be, that seems to be that's going to cause adverse effects down the line, perhaps with your liver or your kidneys or something. Like, was anything like that brought up with you by your doctor?
No, but I did my own research on it, and I decided that no, we're not going there, and because it's not how I like to live, and so so I just weaned myself off. I told the doctor I'm not on it anymore. I weaned myself off, and she just said, "Oh well, good for you," and so that's kind of how that was left. So I just took over the counter. If it gets bad, I get take over the counter plus naturopath.
I can't say I blame you, because obviously I feel, perhaps you agree is that maybe that way to go is better than the alternative, especially if the medication that they were giving you at the time is addictive, as the surgeon openly admitted, for sure. And then tell us about how you reacted when you found out, you've been waiting for about 2 years at this point. You then found out that you're going to be waiting another year to receive a hip operation, which is, a serious operation, but pretty standard for, most healthcare systems around the world. Thousands are done every single year. Tell us how you felt at that moment when you thought, oh, I have to wait another year now before I can even receive a hip surgery.
Well, I was willing to wait a year, but then as things started to get shut down, like over the COVID stuff, the decisions that they were making to stop surgeries and to lock everybody down, I was thinking, this is not going to end well. And so, I'd phone them and say, well, we can't give you a date anymore, because we only get our OR times once a month. And then, of course, for a long time, they weren't doing any surgeries at all. So everything stopped. And, I know they blame it on COVID, but honestly, I don't know if I should say this, but like, I remember back when my mom got a hip replacement done. This is way back when, in 2009 or something. And at that time, there was a long waiting list. And at that time, she was in a lot of pain. And we actually had to take the x-rays to her surgeon and say, please look at these x-rays. And he looked at them and he bumped her up to the top of the list. But had we not advocated for her, she would have waited. And so, I mean, COVID slowed it down, definitely, but I don't totally blame COVID.
Yeah, it's funny you say that because, what you're saying there sort of ties in with the research that we've done at secondstreet.org in that, governments are very easy to blame COVID, and COVID has exacerbated the problem for sure. But we've seen that, the growing waiting list problem in Canada has been rising for years prior to COVID, and it's not even due to a lack of money. Obviously the investment has been there, but of course, these waiting lists continue to grow and grow and grow. And of course, it's leading to adverse problems and consequences of, Canadians like yourself who are just, battling day to day, and can't get treatment because, the waiting lists are so high. And then obviously they were telling you, obviously, we can't give you a specific date. So you're effectively on a year-long waiting list, but 1 year is in parentheses there, being that, that they could cancel surgeries again because of COVID. So you could even be waiting longer. Did they explain what the reason was to you? I know they say COVID, but did, your doctor or any surgeons explain specifically what it was, like a staff shortage, or they were worried you were going to get infected, or was there any rationale behind it, or was it just COVID-19 and that's the reason?
Well, yeah, it was just because of the shutdowns, because the lockdowns, because all the surgeries stopped, and so then they couldn't pull you in when they said they were going to, and that. So then I went online, because you can look online to see how far you actually are away from. You can look up your doctor, you can look up the type of surgery, and you can see how far away you are. And I started doing this in about November, December, and at that point it was 93 weeks away. And I was thinking 93 weeks is just about 2 years, because there's 52 weeks in a year. And I'm thinking, this is a far cry from what it was back in April of 21. So so I knew then that things weren't flying how they had first said anyway, how they had first promised or whatever.
Yeah, and 93 weeks, like that is a long time to wait, especially in the pain that you were in at that time. And like you said, a couple of minutes ago, obviously the pain is getting worse and worse. It's phenomenal that, we have a healthcare system funded to the tune of billions of dollars, and yet you were waiting 93 weeks. So, we were speaking before, and of course, like so many Canadians before you, Sharon, you really were in such a desperate situation, living in so much pain, that you effectively had to take matters into your own hands. Tell us a little bit about that, like, the research you did into looking elsewhere for surgical options and what you eventually landed on.
Okay. Well, so in about November, December, I decided to go online and just look and see what was out there. And so I found, I just went on and asked for private surgeries and see where they were located, to see who was eligible for it. And so I found one in Calgary, Vancouver, and Winnipeg, and Toronto. And so I thought Winnipeg would be the closest, but when I talked to them, they said that they more or less do day surgeries more so than overnight. So then Calgary was my next choice, because it was somewhere where we could drive there. And so then I emailed them and explained the situation, and I just asked about their services. And they were very prompt in getting back to me. And they said that what they do is they do surgeries, and they can do it in 8 to 12 weeks. And then they said, if you want to send us the x-rays, we'll look at it and tell you if you're a candidate.
Interesting. 8 to 12 weeks, that's a much bigger difference compared to 93 weeks in that sense.
Yeah.
And the clinics you mentioned as well, I noticed you mentioned Toronto, Vancouver, Winnipeg, and forgive me, I forgot the fourth one. Toronto. I noticed none of them are in Saskatchewan. Was there anything available in Saskatchewan for you?
Not that I saw, no.
Interesting. So you had to go out of province
Yeah.
To basically find these services. And obviously then you landed on the one in Alberta. How easy was it to book in the system, with the Alberta clinic? I mean, obviously you were facing a 93-week waiting list on the public system in Saskatchewan, but tell us, what it was like just booking in, the appointments, the consultations, and the surgery with the Alberta clinic.
Mm-hmm. It was real easy. I just emailed, they responded. I mean, they would respond within a day. And They had a look. I sent them the X-rays, and they had a look at them. They sent back an email saying that I was a candidate, and they said that they would book me an online appointment with the surgeon, which I did. I had the online appointment with the surgeon, and he showed me the X-rays. He showed me the good hip, showed me the bad hip, and he showed me the difference, and he explained everything, and it was very informative. And then later on, I had an appointment with the anesthesiast. I think that's how you say it anyway. And they explained what they were going to do and asked if I had any questions or anything. And then the woman that I was dealing with in between, anything I had a question about, I would just email her. She'd get back to me, or phone or whatever. And it was just like back and forth, back and forth, back and forth, easy. Yeah.
Yeah. So not to put words in your mouth, but it sounds like you had really good comprehensive care with this clinic, that they were answering all your questions, and, nothing was too difficult for them to basically help you out with. Is that fair to say about them?
Fair to say, yes.
Yeah. Yeah. It's interesting. So, and, just to clarify for our viewers as well, what sort of time frame did they sort of quote you with? Like, once we get you, from the moment you called them up asking them, hey, I've got this issue, what sort of time frame were we talking from that point to the moment you would be on the operating table?
Okay, so December is when I first started emailing them, and the date of the surgery is April the 12th. So it's approximately 16 weeks. I'm thinking it was a little bit more than the 8 to 12 that they had initially said, but it was close. And in fact, when they told me at first 8 to 12 weeks, they said, but the surgeon sometimes does get extra OR time. And so if he does, we'll call you sooner. And so they said that they had done that for some people, and it didn't work out that way for me, but even April 12th was a good date for me. Because especially driving, in the winter, and that, it was good because we've had a wild winter here. So it was for the best.
Yeah, absolutely. And this is going to be a very obvious question. Forgive me for answering it, but I have to ask it for my own peace of mind. Did you find it bizarre that you could obtain these surgeries out of province and even abroad? I imagine, we've spoken with people before who have gone abroad to Lithuania and places like that to get surgery. Did you find it bizarre that you could get this surgery out of province, but there was just nothing available? Like they wouldn't even allow you to pursue it in Saskatchewan, and you were just stuck on a public waiting list there for 90 plus weeks?
Yeah, I mean, I didn't ask a doctor here if there was such a thing as private surgery here. I didn't see it online, so I just went with what I found from my own research. But yeah, it is. The health system is a little bizarre. It is a little bizarre. I don't know, with a few things, but yeah. I think it needs an overhaul.
Yeah. And you're also, like, your story is quite interesting in the sense that you also asked, speaking to me prior to this, you also asked the provincial government if they would be able to help cover the cost of your surgery in Alberta. Now, again, I don't want to put words in your mouth, so correct me if I'm wrong with saying this. You asked them, but they said no, because you go in the private option. We're not able to help you. You have to pay for this fully out of pocket. Which, some will say, okay, well, yeah, it's a private option, but then others will say, well, you've paid tax all your life for a surgery that they weren't able to provide for you. Would it not be fair that they could cover all, or even not like a little bit of your surgery? Like what was their reaction when you approached them and you said, hey, can you help with the cost of this? Were they understanding? Were they dismissive? What was their response to when you asked them?
Well, the reason I asked them to begin with was because they had been talking publicly that because of the backlog, they were starting to look at private surgeries to help with the backlog. And so I thought, okay, great. I'll be part of that, that experiment for you then. Anyway, I started the emailing back and forth. And at first it sounded a little hopeful, but then the more we talked, the more it was like I'd get passed from kind of different departments to different departments. And finally it came down to, well, if your surgeon here will refer you to us. We will look at it. And so I thought, okay, I'll phone my surgeon and ask him if he'll refer me. And I thought, one less surgery for him to do, what's the big deal? And so anyway, I phoned their office, and the lady at the receptionist I talked to said she would talk to him. And so she got back to me and she said, because they can do the surgeries in Saskatchewan, they will not fund the private surgery out of province. And so she said, but she said, he will have another look at your x-rays. And so he did, and he bumped me into a different list, which would be a shorter list. So I said, okay, tell me this shorter list, how long is this shorter list? And she said, well, we don't know, because we don't get the OR, we only get the OR times once a month. But probably it wouldn't go past November, which is still a fair ways away. And so I thought, you know what, I'm not going to take the chance, because what if they lock us down again? And what if, we don't know what's going to happen, because I've kind of lost a little bit of trust because of things that have happened. And so, I just decided to pursue it. And then when I did phone and ask on the wait list, they said, well, we don't really know yet, but call back in May, because it could be 3 to 5 months. So it's too vague, it's too convoluted. So I said, I'm moving on, and I'm just going to do this. And
yeah, that's totally understandable. I mean, November in my head automatically raises flags, because I'm thinking that's winter, that's an optimal time for COVID cases to rise again. And of course, that could be an optimal time for them to stop the surgeries like they did last time. Did they give you any reassurances or anything that they wouldn't, stop the surgeries again? That, okay, well, we've learned from last time, we've got a plan in place to make sure that doesn't happen again? Or was it just very much that, it's going to be November, try your luck, and if we lock down, we lock down? Like, was there any sort of communication with you about any reassurances to make sure that wouldn't happen?
No, they didn't even mention lockdown. It's in my head, like thinking it's a possibility. And so, if COVID would have been just a 2-month ordeal, but a 2-year ordeal, and people are still walking around in fear, I don't want to go there. And so I thought, no, that I don't trust. I don't want to say I don't trust them. I just don't believe it. I mean, it's possible that they could lock it down again. And so this is a safer route for me. And I kind of like my summer.
Yeah. Understandably as well, because you've been living in this ordeal for so long, and it seems, it's just my opinion, but it seems a little strange that you've been paying taxes all your life, and they wouldn't even help cover the cost of your surgery a little bit. I mean, when you consider countries, I think of the Irish example in Ireland. If you've been on the waiting list there for a surgery on the public system for, I think it depends on what the issue is, but standard is about 6 to 8 months. If you've been on the public waiting list for that time and they're unable to see you, the Irish government will actually either fully or partially fund you to obtain a private surgery anywhere in the European Union. So effectively, they have the public system there, the universal healthcare system there to help people out. But of course, for those people like, in your category who are in prolonged pain and suffering, there's the other option that the government will say, okay, well, we're not going to let you suffer. Obviously, you're going to have a spare option. And it seems like, countries around the world like that, like Ireland and even the UK, which have a, public and a private system to help out with waiting lists, they seem to be a little bit ahead of the curve, compared to Canada, which is just very much, we have our universal healthcare system, which is great, but we don't seem to offer any alternative for people trapped in the system like you who are waiting a long period of time.
Yeah.
On that note, if there was anything you could say to, provincial politicians about, what you're going through and how you feel things could be reformed, like you alluded to earlier, what would you say to them? Like would you say, how would you describe the pain you're going through, and what needs to be done to ensure that other Canadians don't go through the ordeal that you've been through?
Okay. Well, I would say, this is just my opinion, but I would say take the people that are on the waiting list, let them go and get fresh x-rays, look at the x-rays, take the ones that need the help the most, push them into private surgeries, and let the others stay on the list if they're not as in need. I mean, I'm not saying everyone isn't in need, but there are some that are more degrees than others. And let's clean it up. And, like there's ways to do it. And money seems to be no object with other things. So let's let it be no object with our health system. And that would just be my opinion, but that's what I would say.
Yeah, that's absolutely fair as well. So, yeah, and you've got your surgery booked for April the 12th, I believe you said, in Alberta. So best of luck to you for that. To end on a positive note as well, Sharon, what are you looking most forward to once you get that surgery and, you're off the operating table? Of course, there'll be maybe, a few months of rehabilitation and perhaps follow-up physio. What are you most looking forward to getting back to doing once the surgery is done that you can't do right now?
Okay. Going for walks. Like I live in an area where there's nice walking paths and that. So I used to do them before. So going for walks, gardening, yard work, being outside, in-store shopping, not having to get my groceries delivered. And that you go actually walking in the stores, and being with the grandchildren, like taking them to the park or wherever, and being able to be engaged with them. So things like that, housework even, because now I'm really slow at doing everything. And so I'm getting it done, but it's not done as good as I'd like it to get it done. And I just wanted to kind of go back to the funding just for 1 minute.
Yeah.
I also pay, because I'm retired, I pay, for healthcare, I pay to Great West Life, and I pay $100 a month for health benefits. So I called them as well and asked them if they offer anything to help out with expenses, and no, nothing. And so anyway, that was just another thing of continuing to pay for healthcare but not getting healthcare, and so that was just another factor.
It's another sticking point, really, that you sort of, just like paying your taxes, or whether it's paying your extended health benefits, you're paying money for a service that you just seem to be not receiving anything in return. So it's just like you're throwing money at something to, that's there to help you out. And then when, the time comes, you're not able to get that help, which I can imagine is incredibly frustrating for you. On two fronts, really. You're paying the government money, and you're also paying this private health, as well. So fair to say that you're probably incredibly frustrated with that, just as I'm sure many Canadians around the country are.
I just wanted to mention one other thing.
Sure.
I have found since hobbling around on a cane or whatever, going places, I have found that people have been very kind and very, very giving, and very, I go to church and someone comes out, opens the door for me, come in, can I help you? Even though through the whole service at church, I'm sitting down instead of standing up, but still people are kind, people are, I must say, people have been very good to me. And so I just want to thank the Lord for that, because I'm very grateful to him for that. Even though, you don't know what life is going to bring you, but it's so nice to have some support, it's nice to have that encouragement from people. So I just wanted to mention that.
No, of course. Yeah, I'm glad you did as well. And it's the little things like that sort of, help us through difficult times like what you're going through and everything. So that's great. And thank you for saying that too. So, and for those watching as well, if you'd like to learn more about our research and all the information that, is available on our website about Canada's growing waiting list crisis, please do so at secondstreet.org. We've got an abundance of information on there about the growing waiting list problem in Canada, and also potential solutions for those waiting lists and how we can help out, people like Sharon who are dealing with, problems with these waiting lists each and every day. So again, Sharon, thank you so much for joining me today. I really, really appreciate it. And best of luck on April the 12th as well.
Thank you.